Hello, Jill.
Hello, Valerie. How are you?
I'm doing well. How are you today?
I am good. It's nice to
Awesome.
talk to you.
Yeah, this is great. I'm so glad we have a little bit of time to chat. Why don't we start by maybe introducing you and telling everybody a little bit about you and who you are?
Well, I'm Jill Blakeway. I'm the founder of the Unova Center in New York City and the author of 3 books. The first one was called Making Babies, which I think is probably very relevant to your podcast. The next one is called Sex Again. And my latest book, which has only been out a short while, is called Energy Medicine, The Science and Mystery of Healing. Oh, and you have your copy.
Yes. So we met in Vancouver at the IF Symposium, the Integrated Fertility Symposium, and I have to say I was completely struck and in awe of you and the essence of you as well because of how you treat the whole person and how you look how things interact with each other. And so I wanted you to just share with everyone a little bit about some of your clinical practices and what's led you up to this point.
Well, I'm an acupuncturist and a herbalist, a practitioner of Chinese medicine. And as you know, Valerie, Chinese medicine is particularly good at seeing a whole person. And that's because we do something called pattern diagnosis. So no symptom really makes sense to us except in the context of other symptoms. So we're always looking at the relationship between the body systems. So in fertility enhancement, for instance, I'm often looking at the cardiovascular system and its relationship to the reproductive system, or the digestive system and its relationship to the reproductive system. And Chinese medicine has ways of bringing that all together. So we practice what's called polypharmacy. We rarely give a single herb, and we create herbal formulas for our patients that treat their specific pattern and start to draw the relationships back into balance. And I think that makes us different to conventional Western medicine. I have enormous respect for Western medicine, actually, and its precision, its diagnostic precision. But as you know, in order to achieve that precision, they split the body up into lots of different systems. And the integration between them is of less relevance, I think, to that system. So that's why we work well together, of course, hand in hand. And I've always been a fan of integrative partnerships. I wrote my first book, Making Babies, with a reproductive endocrinologist for that reason.
Right. Oh, so which reproductive endocrinologist or fertility doctor do you work with, or do you work with all of them?
I work with all of them. At the Unova Center, we treat everybody's patients. And so we don't have a specific relationship. I wrote that book with a doctor called Dr. Sammy David, who was the first person to do an IVF in New York State, the first doctor. But we have relationships with all the fertility doctors in New York, and we treat all their patients.
So what would be some key advice you would give women that are seeking fertility treatments that maybe haven't been able to conceive or get pregnant? What would be the place where you'd have them start? How would they work with someone like yourself?
Well, in my book, Making Babies, I actually gave a 3-month program for different fertility types. So the first place to start is not all fertility problems are the same. So when you read about a fertility herb on the internet, it may not address your specific problem. I advise people to see an acupuncturist. There's plenty of research that shows that acupuncture supports the efficacy of IVF. There's some really interesting research, a big meta-analysis done by one of our colleagues, Dr. Lee Hollander, that looked at what's called whole systems Chinese medicine. So that's like everything we practice: herbs, lifestyle adjustments, diet, acupuncture, moxa cupping, the whole thing. And what they found in a retrospective study of people who'd done a whole systems acupuncture, just acupuncture around IVF, the people who did whole systems acupuncture for 3 months before their IVF cycle had a much greater live birth rate. And that makes sense, I think, instinctively to people. The better shape you're in before you start this process, the better outcome, and that's true even if you're not doing fertility treatment. If you're planning to get pregnant, it's worth having what we call at the Unova Center a little premester. and spending 3 months getting yourself into really lovely shape so that you have, we hope, a healthy pregnancy, and we give you the best possible start. So my advice would be to have whole systems Chinese medicine, if you can, for 3 months before you even start this process.
I really like that, the pre-semester or pre-mester of before the trimesters start. That's great. Well, let's dive into some of the research that you did for this book, because that was a majority of what we were talking about in general. But it sounds like, you went and did some really great training. And do you want to share a little bit about that?
Well, you're right, I went on a really fascinating journey, one I didn't know I was really going to go on. I started out, I just wanted to explain me to me, and in a way, us to us as acupuncturists. And what I thought was that we'd spent a lot of time looking at the physiological effects of acupuncture, a bit like the research I just quoted to you. But you and I both know that there's some magic happens in the treatment room that's about connection, and I wanted to see if that was physiologically measurable too. So HarperCollins very kindly sent me all over the world to talk to healers and scientists about the therapeutic connection energetically and how it can be measured and how it affects people. And what I found was quite surprising. You attended a lecture I gave at the IFS, so you know that I have my own body measured to see what happens when I do acupuncture. And I found that my brain and my heart go into resonance with each other, which means they go at the same frequency. And to do that, I slow down my brain quite a lot. And I must have taught myself to do that. I'm a very experienced acupuncturist. I've done it for over 20 years, and I've treated a lot of patients. And somewhere along the line, I taught myself to do that. But I don't think I'm particularly special. I think we do. That's, it's our job, and we do. And there is actually some research that shows that people who practice acupuncture, their brains change, which is, I think, partly because we start to see pattern, and partly because we start to do this very meditative thing in clinic. And then, having measured me, we found that the patient's heart goes into resonance with mine, which means we're all going at the same frequency. And that isn't something particularly woo, although it sounds it. They do that thanks to something called mirror neurons. They start to mirror me, and I get very calm. I start to go at the same frequency between my heart and my brain. They start to do the same thing. And I think at that point, the magic happens. I think at that point, we pass information between one living being and another. And in our case, we do it with acupuncture, although I certainly saw hands-on healers and doing remarkable work, and other types of healers, sound healers, any kind of vibration, really. And really what it is, it's information carried on a wave when people resonate at the same frequency. And the term for that is creating a resonant bond. And so I found that I inadvertently create a resonant bond, and I think most of us do. So that was part of my journey.
Oh, wow. Yeah, that was incredible. And also, I really liked the story you told. Maybe you can share about this too, of the healer that could feel no pain.
Yes. I went to a place called Fukuoka in Japan, which is on an island off the south of Japan. It's nearer, really, to South Korea than Tokyo. And there is a yogi there called Master Kawakami. And he is a fascinating man. He's in his 80s now. He was Mr. Japan in 1979. He was a bodybuilder. And at some point, he decided to stop focusing on his outsides and focus on his insides. And he went to India and studied very hard. And he is a very highly trained yogi. And he appears to have mastery over his body. So I was a little daunted about going to see him, Valerie, because I've seen video of him sticking skewers through his neck and his tongue, and he appears to feel no pain. And in fact, when he has been studied, they've put him in an MRI and burnt his feet with lasers, and his brain registers no pain, but he floods his body with endorphins. And I was interested in him because in some ways he's like his own placebo. The placebo effect works because our minds start to prompt physiological change in our bodies. And I thought that, he's learned to do that to a very great degree. And in a country in the middle of an opioid crisis, it's actually interesting he's not superhuman. He's highly trained and very disciplined, but he's just a human being. Right. So if he can do it, we can do a form of it. Right. So I wanted to go and talk to him about how he achieves that kind of mastery over his body that is physiologically measurable, so that his brain doesn't register pain in the same way that mine would or yours would, I think. Right. And really what it takes is a lot of discipline, a lot of meditation, and belief, and a sense of being safe in the world. He has an absolute belief in his own safety that I think most of us don't. Most of us are on the internet, picking up clickbait that tells us we're all in terrible danger at all times. Local news, never picks the good news, does it? It's always like horrible things are happening and could happen to you. And so we are hyper vigilant, and that sets us up, I think, that expectation sets us up to feel pain. And I think he has the absolute opposite, where he sees himself as spirit having a physical experience, and that from that perspective nothing can harm him. So he was a fascinating character. And at the end of my time with him, I said to him, Sifu, which is like master, I want to come back and study with you. And he said, bear in mind, he's 80. He said, well, don't worry. I'm going to live till I'm 110. So you've got plenty of time. And I kind of believed him. I was like, oh, okay.
How did you get in touch with him? Like, he seems like he wouldn't necessarily be somebody that could just be accessed.
Yes, I followed a trail of breadcrumbs, really. I didn't know when I started the book where I was going to end up, and HarperCollins were very indulgent with me. I would, I think at some point I dropped my editor an email and said, I'm a little off track, and she was like, carry on. And of course, as you know, it's a really interesting book because of that. And I always say that the book wrote me rather than I wrote the book, because the next door opened. But I heard about him through some researchers at San Francisco State who had measured him, and I was interested, measured his physiological reactions, including the same research I'd done on me to see what happened to his heart and his brain waves when he was working. And so I was following that trail of what happens in healers' bodies when they heal. And I didn't actually mention that, Valerie, but he is actually also a very good healer, as well as puncturing himself with skewers and being impervious to pain. He sings in tones, which is fascinating to me, and they're quite discordant, but the patient appears to go almost into a trance. They go to sleep, and then he hands them a clipboard. I've never seen anything quite like it, with some paper on, and they write what's wrong with them with their eyes shut. And he does a sort of version of hands-on healing. Yeah, they do.
Wow.
And I have video of him doing that with me, and it's actually very interesting. So I was interested in what happened in his body, and I thought he was someone who had so much mastery over his body. I stood a chance of being able to understand it, and
interpret it too,
as you know, I wrote more or less a chapter in the book about him.
Yeah. So was there a takeaway that we could bottle and digest ourselves and start training our brains as well? Like, is it something that can be taught, do you think?
Yes, I believe it is. And in the book, I give lessons at the end of each chapter to sort of build on energetic skills. And they're worth following, actually. They seem simple, but they're very profound. They're often visualizations. And we think of visualizations, I don't think we understand how powerful they are. But our visualizations change our energy field, and then create change in our body. So it can be taught. I am a baby in comparison to him. And that was actually one of the gratifying things of this. I found my next path by seeing people who are much better than I am, and learning from them, and realizing how far I have to go.
It's okay. It's just like like he's in the Olympics and you're in professional sports.
Yes,
You know?
exactly. I'm working my way up the league.
That's right.
And I have people I can look up to. And that was part of the fun of this book.
Right. Well, getting back to the visualization, because I'm really fascinated by this. Do you think that's why, like, for example, porn is so, the graphic nature of porn is so powerful, that those visualizations, whatever they might be, could impact our receptors and how we interpret things?
I think it's a complicated question. In my second book, Sex Again, I looked at the effect of porn on libido. And, in Chinese medicine, we would say it's very draining of your kidney energy, as you know. And the reason it's draining is because there isn't anything coming back to you. That sex is meant to be an energetic exchange between two human beings. And if you're watching someone on a screen, they're not loving you back. They're not giving
it's
back.
One-sided.
And so there's no energy coming back in. And in Sex Again, I taught lessons in how to circulate chi energy between yourself and a partner to get that very intimate energetic connection. So I think porn in some ways is depleting because there is no energetic exchange. It's all output in some way. It's also, of course, very unrealistic. And I treat a lot of women, and I think porn is very destructive to their self-image. Women talk a lot about their libido being low because they don't feel good about themselves.
Right.
And of course, porn stars are a very specific category of people who are built to do porn, and often with surgery. And I think it misses the point of sex.
I also think it messes with our psyche of what a partner wants, right? Or changes our brain in thinking like, oh, that is attractive, or oh, that is sexy.
Yes.
And so then we feel less sexy or less attractive to our partner because of some of those visualizations that we see.
I think so. Porn sex isn't like real sex at all.
Yeah.
And it's very performative. It is a performance. And it's not that I want to be hard on porn stars at all. That's their choice, and that's their line of work. But it is a performance. But in real life, with someone that you feel comfortable and safe with, you shouldn't really have to perform, and or not in that way. And so I think there's a lot to be said for building a sexual connection with another human being that is based on love and respect and deep intimacy. And that doesn't look like porn sex usually. I think. Of
course not. Yeah. And then you throw in the whole aspect of struggling to conceive or having a baby with someone, and now you've mechanicalized sex in a way like, oh, well, I'm ovulating. So maybe you can give a couple of tips from that book that would help a couple that's struggling to connect and stay emotionally connected for the purpose of creating a family.
Yes, I actually think it's really important, and it's why I wrote Sex Again after writing Making Babies, because my fertility patients would tell me, when I'm done with this, I'm never having sex again. And I'd be, no, we must. And it's hard, to have sex on a schedule in order to conceive is hard, and it's hard on both partners. Men in our practice often tell us they suffer from performance anxiety. We treat male fertility as well as female fertility, and also that they feel devalued in some way. Men sometimes tell us that they feel like a sperm donor rather than,
it's so mechanical.
Their partner. And so I think it affects both sides when it becomes mechanical. And that's why I wrote Sex Again, to try and make the point that the energetic connection is the important part of this. And there are exercises in the book that are about encouraging intimacy and aren't about performative porn star sex. And one of the things that I did encourage people in the book to do was what's called a loop. In Taoist sexology, they call it the microcosmic orbit, but I thought that was a bit much for my
audience,
my patients, my modern New York patients. So I called it the loop. But it's about the book takes you through a series of exercises, and you start by making a loop in your own body. So you learn to loop energy down your spine and up. the front of your body, and then you start to loop energy through someone else too, and then eventually when you get to be a really good looper and experienced, you do it during sex and coordinate your breathing too. So one person breathes out as the other person breathes in, the energy goes down her back, it goes up his back, he breathes out. You see how that
where
works.
the infinite sign, that like the number 8 kind of comes in?
Yes.
Oh, interesting. Yes. You just drew those two coordinations together for me. Amazing.
And of course, in a heterosexual couple, you can do this no matter your sexuality or gender, actually. But in a heterosexual couple, that unites yin and yang. And that's why it's called the microcosmic orbit. I would put it to you, actually, that in a same-sex couple, it also unites yin and yang in both of them. So, but that was the original origin of that exercise thousands of years ago in China, was to unite yin and yang energy into a whole.
Yeah, I mean, you were just a wealth of information. I think we could talk all day. I just want to address a couple, like, there are a group of people out there, or individuals that may think in their head, well, this sounds like all of this energy healing and all of this type of, Eastern medicine meets Western medicine. It could sound, in theory, until they see the effects on themselves and see it working, as something that maybe is, could be debunked or maybe not real medicine. So can you speak to that for a little bit and just kind of like share, because you've been in practice as an acupuncture, 20 plus years? 30 years. So not to age you.
25, I think.
Yeah, exactly. Like, not to age us. Well, we're still 20, right? But 21 forever. But yes, so through your experiences, you've seen, maybe give a success story or something on those lines that can just help encourage someone to really explore these different avenues.
Well, I wrote this book, Energy Medicine for Skeptical People. HarperCollins asked me to write a book for people who didn't necessarily believe. And it's very heavily footnoted, and it's very rooted in science, as you know. And I did that on purpose. I wanted to make the science fun, so I told memoir and travelogue and stories. But I wanted people to understand that there is a scientific basis for this, and that it's measurable. The human energy field is measurable. We measure aspects of it all the time. I mentioned having an EEG, that's a measurement of the energy field of my brain, or an EKG, which is a measurement of the energy field of my heart. Now, doctors do that all the time. They don't necessarily look at the relationship between the energy fields of different organs, and they don't necessarily look at the relationship between the energy fields of one person and another person, but the science is there. So, for instance, at the University of Connecticut, they put people in separate MRIs and separate rooms, and when one thought about the other, their brainwaves synced up, which is exactly the feeling we have all had when we think about someone and they text us, which does happen more than could possibly be a coincidence, doesn't it, to all of us? And that was actually measurable. And so I looked at that kind of science in the book. And when it comes to acupuncture, I dedicated a whole chapter to acupuncture and the scientific basis for it. As an energy medicine. And the effects of acupuncture are easily measured physiologically. You can show on MRI that it changes the brain and it changes the perception of pain. You can show with Doppler ultrasound that it affects blood flow and blood circulation. You can use thermal imaging to show that it reduces inflammation. But I started to wonder, well, how does that work energetically? And I started with the University of Vermont did some very interesting research where they looked at the unique nature of acupuncture points and found that an acupuncture point has a greater pull force on a needle, i.e. it takes more energy to pull the needle out than other points. They're different. And when we stimulate the needles, which as acupuncturists we do, we tap the needle in and then we wind it a little bit, the connective tissue winds around the needle like spaghetti on a fork. And when it does that, it becomes more electroconductive. Now, connective tissue is electroconductive anyway because it has a high collagen content, and that has a high water content. And as we know, water conducts electricity. But it becomes more electroconductive at the acupuncture points. And then in the book, I followed that trail. I asked, why are the acupuncture points like this? How did they form? And to put it briefly, they come from embryology, and there's a reason for that. And then I asked myself, how does the signal get from the point deep inside the body? And it would appear that it follows the path of the fascia, which is a form of connective tissue that is very electroconductive. So acupuncture is an electromagnetic intervention. It's not just an electromagnetic intervention. As you know, we can use acupuncture needles to break up muscle spasms, and then we're using it a bit like massage. We can give people an endorphin release so they feel nice and floaty. We can change body chemistry like that. But there is a sort of measurable effect that shows acupuncture's efficacy. And I wrote that in quite some detail in the book. So I would say if you're a skeptical person, I applaud you. I think I love an open skeptic myself. I think dogma goes both ways. Do you know what I mean? New Agey people can get very dogmatic about their beliefs. Yeah. Skeptics can get very dogmatic about theirs. Sure. But if you're an open skeptic,
you're so ingrained in focused that it's hard to see outside of that perspective.
Yes. I mean, confirmation bias is a bit of a drug, and we all get addicted to our own beliefs and then, only see what we want to see. But if you are an open skeptic, I would love you to read Energy Medicine, The Science and Mystery of Healing, and tell me what you think, because I wrote it for you. I wrote it mostly for open skeptics who are interested in how things work.
Awesome. Great. Well, you give so much of yourself in your practice, in your writing, and all of your activities. How has these skills worked for you personally? Like, have you been able to dial it back and give yourself self-care and analyze some of these techniques for your own well-being?
Well, not always, and certainly not in the early days. And in the book, I write honestly about my own journey. I got very depleted for a while. I got a bit sucked dry. I didn't really necessarily, to start with, understood where I stopped and other people started. I sort of overgave of myself in some ways, but I think it was all part of the learning curve. And in the book, I describe I ended up with a heart rhythm disturbance. I was very honest about my journey. I think if you're going to write memoir, you should be honest, and it didn't always look pretty. But as I got older and I got more experienced, I have 18 acupuncturists working with me now at Unova. They're all awesome. I have a phenomenal team, and my staff will tell you I'm not a micromanager. I believe you work with great people and you let them be great people, and they often just amaze me with their creativity and their smarts. So I have let go of a lot of minutiae. That's helped. And then during the course of writing this book, I changed. This book changed me, and everybody who worked on this book said the same thing. It changed the way I saw the world. I realized we're all connected. I gave you a little glimpse of that in the University of Connecticut MRI studies, but in the book, I give you a much stronger case for that. And that we're all in silent collaboration with each other, that we are all truly at some level one, and that when we forget that, we become fearful and cruel. And so it changed me, and it gave me some perspective that I hope the reader gets by the end of the book, that we are ultimately safe, and that we are part of something much bigger than ourselves, and that it's all okay. So even scary things that go on in the country and things will all eventually, be okay. And so I became much more, I used to live off my nerves a lot more and be much more of a worrier. And I learned to let go during the process of this book of the things that it's wise to let go of. And then, of course, there are some things it's wise not to let go of. And I think that comes with experience somehow.
Oh, Jill, well, this has been such a lovely chat. Thank you for spending a little bit of time with us and sharing your wisdom and your knowledge. And we'll put all the links and everything for people to access your books and being able to reach you. So any last words or anything left you might want to share with the audience?
You know, breathing is way more important than you think. In this book, I learned that the reason that my heart and brain go into resonance is because of what's called resonant breathing. And there is no replacement for when you are a little in your fight and flight, just taking a breath deep down into your abdomen and settling yourself. It sounds so simple, but take a breath, people, before you react, before you do anything, before you type something on Facebook. Get yourself grounded and take a breath.
I love that advice. Such great advice. Well, thank you so much, Jill. We'll catch up with you again soon.
Thank you, Valerie. It's been lovely to talk to you.
Bye for now.
Bye.